speech-language pathologist here at IVH.
And I'm Sarah Menzel, the dietetic intern.
Today we're going to differentiate between coughing and choking.
Choking is the fourth leading cause of unintentional injury, death, and food is often the culprit.
According to Injury Facts 2017, choking is the fourth leading cause of unintentional injury death. In 2015, approximately 56% of people who died from choking were 75 years old or older. Food is often the culprit in choking incidents in the elderly. In this training, we will define airway obstructions and discuss how to respond when a resident is choking. A resident who is at risk for choking will have a red dot placed on their name tag. These name tags are worn by the resident anytime they leave the unit, including meals in AITHA and activities. There is a special diets binder located in AITHA for food service staff to reference when serving residents who are on a modified diet. Choking occurs when a foreign body obstructs airflow into the airway or lungs. These obstructions are classified as either mild or severe airway obstructions, and knowing the difference between the two is important as they require different responses from staff. During a mild airway obstruction, there is good air exchange which allows the resident to cough forcefully, whereas during a severe airway obstruction, there is poor to no air exchange. The resident will be unable to speak or cry. It is crucial to distinguish between the two different types of airway obstructions as they require different responses. An easy way to remember the difference between mild and severe airway obstruction is to assess whether the resident can cough, speak, and breathe. During a severe airway obstruction, the resident will be unable to cough, speak, or breathe and will require immediate help. With a mild airway obstruction, if the resident is coughing forcefully, encourage them to continue to cough until the foreign object is cleared.
Russ, you all right?
No.
Just keep coughing it out. Cough it out. All right.
I got it, thanks.
Good, Russ.
In a mild airway obstruction, there is good air exchange which allows the resident to cough forcefully. The resident may wheeze between coughs. During a mild airway obstruction, as long as good air exchange continues, encourage the resident to continue coughing. Do not interfere with the resident's own attempts to relieve the obstruction, but stay with the resident to monitor his or her condition. You do not need to call an RN stat for a mild airway obstruction unless it progresses to a severe airway obstruction. If the mild airway obstruction continues or progresses to signs of severe airway obstruction, activate the emergency response system.
Are you choking? All right, we're gonna do the Heimlich.
During a severe airway obstruction, there is poor to no air exchange. The resident might clutch their throat with the thumb and fingers, making the universal choking sign. They will be unable to speak or cry. They may have an ineffective cough or no cough at all. You might hear a high-pitched noise while inhaling or no noise. There is increased respiratory difficulty and possible cyanosis or turning blue. When responding to a choking incident, ask the resident if he or she is choking. If the resident nods yes and cannot verbally respond, a severe airway obstruction is present. You need to take steps to immediately relieve the obstruction by either abdominal or chest thrusts. Someone should notify the switchboard by dialing 4333 and calling an RN stat. If the resident becomes unresponsive, begin CPR. The Heimlich maneuver in CPR should only be administered by a trained individual. You would never perform the Heimlich maneuver if you have not received special training. You would need to alert a trained staff member of the choking incident while another staff member calls an RN stat. Nursing staff such as RNs, LPNs are trained in CPR, which includes the Heimlich maneuver. The food service supervisors and some of the food service workers are also trained in the Heimlich maneuver. Although the Heimlich maneuver is considered life-saving and safe to perform, there have been reports of complications. One commonly reported complication includes broken ribs and tears in the gut. Risk of complication increases if the foreign object is not successfully cleared after the first set of thrusts. Other factors that increase risk of complications include incorrect technique or if the maneuver is performed too vigorously. If a choking incident occurs in AITHA, available staff should retrieve the suction machine located in the designated area while another person assists the resident. The suction machine should be plugged into an outlet closest to the resident and may be utilized by the responding licensed staff if deemed appropriate. All the pillars in AITHA have outlets located on the base. Other outlets can be found throughout the dining area. Become familiar with the outlet locations so you can quickly set up the suction machine during a choking incident. Choking is loosely used to describe any coughing episode in long-term care facilities. However, it's important to distinguish between coughing and actual choking. Whenever we document a choking incident in the resident's medical chart or record, an incident report needs to be submitted within 24 hours of the choking event. Speech therapy should be notified by email whenever a choking incident is reported. When documenting choking episodes in the medical chart, do not assume what the resident may have choked on. If a bolus is expelled, describe instead of label. You can comment on size, color, and whether it was masticated. There are several things we as staff members can do to reduce choking risk, especially during meal times. Always make sure the resident is adhering to their diet order. Diets are listed on each tray slip and in the special diets binder in the AITHA. Provide the appropriate adaptive equipment as prescribed by the OT department. Adaptive feeding equipment promotes safety and independence with meals and are listed on the tray slips. The tray slips also list specific directives that the resident needs to follow while eating and drinking. These safe swallowing strategies are prescribed by a speech therapist after a swallowing evaluation is completed. Some residents might need cues or reminders to use these strategies and require supervision. Always make sure residents who require supervision with food and drink are receiving the appropriate amount of supervision and cue the resident as needed. Thank you for taking the time to watch this training and for keeping our residents safe during mealtimes. If you have any questions, you can contact your supervisor or speech therapy.